Is robotic-assisted hip replacement surgery better? What's the difference between traditional hip replacement and robotic-assisted hip replacement surgery? Is robotic-assisted surgery less painful? By the time you're considering hip replacement surgery to treat the pain in your hip joint, you may have seen your doctor or physiotherapist, or your family and friends may have urged you to speak to a consultant orthopedic surgeon to further discuss various hip replacement options. You may have been made aware of the different types of surgery, but have questions around robotic-assisted surgery, what it means, and whether it's right for you. I'm going to explain what's involved in hip replacement surgery and where robotic technology could come into it to help you understand why your surgeon may or may not use robotics at certain points in your surgery. I'm Winston Kim, consultant orthopedic surgeon here at the Alexandra Hospital near Manchester, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. It's worth mentioning that you don't always need surgery to relieve a damaged hip joint. Alternative ways of treating hip arthritis includes simple painkillers, anti-inflammatories, and optimizing your weight to try to reduce pressure on your joints. Physiotherapy can help, having steroid injections, using a walking aid, and reducing activities that aggravate your symptoms. If these measures fail to address your symptoms and your symptoms impact on your quality of life, then you have the option of conventional or robotic-assisted hip replacement. Osteoarthritis of the hip is a relatively common condition as we age, and for some, the hip pain can become debilitating and have a significant impact on your life. If you've got to the point you're considering a hip replacement, you likely have a fair understanding of the anatomy of the hip and an understanding of osteoarthritis in the early stages, right through to the later stages. You'll know what the breakdown and the damage to the cartilage in an arthritic hip joint looks and feels like to you. Generally, hip arthritis causes an aching discomfort in your groin, your thigh, or the outer aspect of your hip and can radiate down into the knee. You often experience stiffness and tightness, which causes difficulties getting in and out of a car or bed, and prolonged sitting or standing can cause discomfort, and your walking distance can be limited by pain, worsening the longer you're on your feet. As hip arthritis progresses, your sleep may be disturbed and your ability to move as you did before can become very limited. In a healthy, uncompromised hip joint, the ball and socket joint is lined with a hard, smooth cartilage which allows frictionless movement throughout your life. Hip arthritis is caused by a thinning or erosion of this hard cartilage in the ball and socket of the hip joint. With arthritis, the stiffness is caused by the muscles around the hip joint tightening up to protect the hip joint. Hip joint replacement surgery is common and is an incredibly effective treatment option, as it quite literally replaces the damaged joint. It is routine surgery with fairly predictable recovery times and outcomes, though of course with any surgery there are some risks. Your surgeon will work with you to take every precaution to minimize these risks. So let's get into the detail of what to expect with the two methods of hip replacement treatment. The differences between conventional and a robotic-assisted procedure starts long before the day of surgery. In a conventional hip replacement, your surgeon plans your operation using plain X-rays to judge the position of where your hip implants should be implanted. The outcome of surgery is determined by the skill and experience of your surgeon in placing these prosthetics to the right alignment for the way you walk and move. Robotics come in during these early stages of planning your procedure. Your surgeon is able to visualize in 3 dimensions the optimal position of your hip replacement using the software, taking into account your size, leg length, alignment and shape of your pelvis. Then later during surgery, the scan is used alongside a robot arm and haptics technology, so we're able to very accurately and precisely position your hip implants according to the pre-surgery plan. Both methods of hip replacement are usually performed under a spinal or epidural anesthetic combined with sedation, so it feels like a general anesthetic, but without any tubes being inserted into your throat. Really, you only remember meeting your anesthetist who will put you to sleep. You will wake up after surgery with no memory of the procedure. For your surgeon, however, there are a few key differences with robot-assisted surgery. The 3D technology using your CT scans allows your surgeon during the procedure to visualize the best position for your prosthetic hip joint for your unique anatomy. During surgery, sensors are placed around your physical joint, which allows the software and robot to detect your joint in 3 dimensions. Your surgeon, guided by the robot, enters the joint and removes just the right amount of bone that is affected by arthritis. Your surgeon, with the technology of the robot, is able to very precisely and accurately position and implant your hip replacement. The precision that the robotic technology enables works to preserve the soft tissues around the joint and aid in less damage done to these tissues during surgery. Robot-assisted procedure, in essence, combines the experience of your surgeon with technology to ensure the best technical outcome for your hip replacement. With both methods of surgery, you'll usually need 2 nights stay. During this time, your physiotherapy team will teach you exercises and offer tips to keep you mobile, to reduce the risks of clots or thrombosis, and to prevent as much stiffness as possible. You will be able to start moving the hip straight away, but for the first 6 weeks, it is important to avoid deep flexion and rotation of your hip. These precautions reduce the risk of the hip popping out or dislocating after surgery. You will be on crutches for between 3 and 8 weeks after surgery. What robotic-assisted surgery means for you is often quicker recovery, shorter hospital stay, and less pain because of how precisely and accurately surgery is performed. This enhanced accuracy also reduces risks of complications like the hip popping out, what's referred to as hip dislocation, leg length discrepancy, or the hip catching. It should also increase the potential for a longer lasting, more normal feeling or natural feeling hip joint after your hip replacement once you recovered from your surgery, typically 6 to 9 months after hip replacement. Your physiotherapist will explain the do's and don'ts in more detail and will be in constant contact in the first few weeks to make sure you feel supported and your recovery eventually gives you the pain relief you're after. About 6 months after surgery and with extensive physiotherapy, with your commitment and dedication to healing and strengthening the hip, you'll be back walking, playing golf, gardening, swimming, or whatever it is your hip pain was stopping you from doing. Full recovery takes around a year or possibly more if you are getting back into sports that require you to strengthen your hip further for full recovery. If you are interested in a more detailed recovery timeline, we have another video where our physiotherapists talk through what to expect in the weeks, the months, and up to the full year following your surgery, where we'll look at what point you'll be back relatively pain-free. So that was a brief run-through of what to expect with hip replacement, a look at 2 methods of hip replacement surgery, the conventional manual hip replacement and robotic-assisted hip replacement surgery, and look at what it is that robotic-assisted surgery does to assist your surgeon potentially improve your outcomes after hip replacement. If you want to come and see me for a consultation for specialist advice or to talk through any treatments covered in this video, you can book online via the link in the description below or search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I have covered in this video, or would like a video on what to expect with a different type of treatment, please comment below this video, as we would love to hear from you. Otherwise, thanks for watching.